But it's, are you doing it off of her so it doesn't echo back?
Yes, you. Good afternoon, everyone. Thank you for joining the webinar today. We have here at Access Health, Deborah Eastman, Katie Hearn, Shelly Pierre, that's me, Gigi Garcia, and Keisha. Today we'll be going over the latest and greatest changes that have happened in our system, formerly known as Release 25. We ask that you keep your mics and cameras muted and off during the webinar. And if you should have any questions or comments, please place them in the chat box and we will answer them at the end of the webinar. Without further ado, I will hand it over to Katie.
Hi, everyone. Thanks for joining us. Okay, so at the end of March, there was a new HCT release. There were two parts to that release, Part A and Part B. We're primarily going to cover Part B of Release 25, which was implemented at the end of March. So we're going to talk about some changes to the HCT application, some changes to the way alimony is counted or deducted. We're going to talk about pregnancy as a qualifying life event. We'll talk about some new checks on Medicare enrollment that are behind the scenes. And we will, Shelly will talk a little bit about some broker portal changes. Okay. So one of the new screen changes that you will see here are, there are new immigration questions. These immigration questions pertain to Medicaid eligibility. So there are questions such as, are you a Cuban Haitian entrant? Are you a victim of trafficking? And there's another one that asks if you're a self-petitioner under the Violence Against Women Act. These are all questions related to immigrants, and they all factor into determining Medicaid eligibility. Okay. Okay, so what you see on this screen here is a pop-up window, and we have added additional back-end verification sources and levels of verification. So HCT may flag with you that there is a data mismatch. And if that occurs, you have the choice of continuing with the data that was entered. You would press the continue with errors button, or you could click OK. And you'll see on the next screen some of the prompts that might come up. So it might be that it seems that a date of birth is incorrect for one of your clients. It might be that a name doesn't seem to be correct. Another flag that might occur is with SEVIS ID, which usually pertains to those with student visas. Another flag there is just that there may have been a technical error, and that just would require you to resubmit. It's like a temporary glitch. If you see that one at the bottom there, we are experiencing a technical error, please try again by clicking the submit button. So that would kind of access those verification services again. It's like it would try again, and in some cases you'd be able to just proceed without any real issue. So you can either so actually, can you go to the next slide? Sorry. Okay, so that's all there is. Sorry, can you back it up one? Back it up another one, sorry. Okay, so if the data that's been entered, you want to check with your client, and if the data that's been entered in the application is what the client says it is, you can continue with errors, and that won't affect eligibility. Okay, you can just kind of put in the data as you have it and continue with the application. So there's a new Connecticut state law that allows pregnancy as a qualifying life event. This went into effect January 1st of 2019. There is a verification component to pregnancy as a qualifying life event, just as there is a verification component to most special enrollments. This is pretty specific in terms of how you have to verify your pregnancy. So an individual must have a letter certifying that they are pregnant from a provider. They must apply for coverage within 30 days of being certified as pregnant by their provider. And they cannot have minimum essential coverage at the time of their pregnancy certification. So we'll talk a little more about this. This is a little bit complex, but I can kind of give you what you absolutely need to be able to tell your client around this. There are 2 new SEP questions on the application for individuals who attest to being pregnant to answer. So you'll still see in the HICS application the question about, are you pregnant and how many children are you expecting? That's still there, but there have been 2 questions added to the special enrollment section pertaining to pregnancy as a qualifying life event. Okay. The first question asks if an individual has been certified by a licensed provider as currently pregnant in the last 30 days. Now, if we had selected the box for Olga Olmsted there, there would be a date field, and you would put in that date field the date that the pregnancy was certified per the provider. In all likelihood, most people calling probably will not have had their pregnancy certified by a provider within the last 30 days. So the question that you're probably going to be answering more frequently is the second one, which asks if the individual expects to be certified by a licensed provider as pregnant in the next 30 days. Same thing, if we had checked Olga Olmsted in that second question there, there'd be an additional date field that you would fill in, and you would be filling in the date on which the consumer states that they would be getting their pregnancy certified by a licensed medical provider. And finally, if an individual applies on 3/15 and states that they were certified as pregnant on 2/28, then their effective date would be 2/1. So effective date rules follow the month of the certification. So based on whatever your certification date is from your doctor, and there's a form that your doctor can fill out, or in some cases they may be able to write a letter, but it's probably best to use the certification form whenever possible. Whatever date is on that form sort of would dictate the start date of coverage. So if it's in a given month, the start date of coverage will be the first of that month. In order to prove they are eligible for coverage for this special enrollment, the applicant will need to provide a form or letter from their provider certifying them as pregnant. Out on the Learn tab on accesshealthct.com, there is a certification form for pregnancy. So that's where you would go. You could print that out for your client. They could take it to their medical provider. And these are all of the things on that form that a provider would have to include if for some reason they do not use the form and they just maybe put this all on their letterhead or something like that. Applicant's first and last name, the name of the provider, the provider's contact information, all of their contact information, their scope of practice, their NPI, which is a provider identifier, and a signature and date from the provider. Basically, with regard to scope of practice, general practitioners can certify pregnancy, family medicine doctors can certify pregnancy, OBGYNs can certify pregnancy. There are other scopes of practice as well, but the provider who certifies the pregnancy has to have that within their scope of practice. And primary care docs, that's within their scope of practice. And they have to be licensed medical doctors, APRNs, physician's assistants. I am not sure about other provider types, but any of those three practicing within a certain scope of practice could provide the certification. Okay, so changes to how we calculate alimony as it relates to modified adjusted gross income. For clients who get divorced in 2019, they are no longer going to be able to include alimony in their modified adjusted gross, and they're not going to be able to deduct alimony from their modified adjusted gross. If their divorce was finalized by 12/31/2018, any time prior to that, alimony is still included both in modified adjusted gross income and as a deduction from modified adjusted gross income. If you have a client who has maybe a complicated divorce with amendments and so forth, and they're really not sure about the timing of events or something like that, you might want to advise them to double check with their attorney or whatever, so that they can answer this question that's been added to the HICS application, which is, was the divorce finalized between January 1st, was the divorce finalized before January 1st, 2019? They have to answer yes or no, because that is going to prompt whether or not alimony is included in income or as a deduction, as the case may be. Okay. This here really is mostly a behind the scenes change. We're going to be checking additional electronic sources to see if a consumer is currently enrolled in Medicare. If they are, they will not be able to enroll in a qualified health plan. This is a little different because in the past, it prevented some people from receiving APTCs, but didn't prevent enrollment in a qualified health plan. Now, if the electronic data source is able to pick up that they are in fact enrolled in Medicare, they should not be able to enroll in a qualified health plan through the exchange. This is also true if they self-attest to being enrolled in Medicare. So if, I think in the last screen, they were showing the family health insurance section. Back up one screen. If they self-attest and they choose Medicare as their current coverage, that will also prevent an eligibility result for QHP. Okay. So that's a good addition. Should help a lot of people out.
Another item that's been updated is when you search for a broker, it will now indicate whether if they are accepting new clients or if they're accepting any special enrollments outside of open enrollment. This is great for both CACs and brokers. Brokers could now be listed properly as it works with their book of business, and CACs will know exactly who to send their clients to and who is actually accepting new clients. Brokers are going to be able to update this information at any time during the year through their broker portals. As you can see on the graphic, there are 2 new fields with radio buttons that you can indicate at any time whether yes or no. So this is a great feature located right on your broker portal. One pain point I know that the brokers have brought up repeatedly is not being able to see more than 250 of their clients through the broker portal. That has now been fixed. So if you were to log in, you should be able to see your entire book of business. If you should notice that someone is missing or not showing up, please follow the proper procedure. The current procedure is contacting the broker support team at the broker support inbox. We'll include that link in the chat box for you just in case you don't have it. And just let us know who's missing and when they should have been, what business should have been written to you. Again, this is just a visual showing that you can now see all of your book of business through Access Health. At this time, we'd like to open up for questions. I forgot to mention that we have both brokers and CACs on this webinar today. So if you have any questions, go ahead and load us up on the chat box. I think we have a few, so we will start reading those right now.
So the first question I have from Caroline is, if the individual is a green card holder and they are not yet at 5 years, can they qualify for insurance coverage for the entire pregnancy or only the delivery?
That's a good question. So if a consumer has attests to being pregnant and has their pregnancy certified, they can remain in their QHP coverage for the entire policy year. So it doesn't end at delivery. It doesn't end if there is some complication with the pregnancy. Good question.
The next one I see from Lisa is, does the system pick up if someone is required to pay for Medicare Part A, as they can get APTC in that case?
No. What it does pick up is if a client is currently enrolled in Medicare. Any client currently enrolled in Medicare is not allowed to purchase a qualified health plan through the exchange. There are some exceptions when it comes to renewals, and we're not going to talk about some of the rare exceptions, but it is illegal to sell a qualified health plan to a Medicare enrollee, and in no circumstances do Medicare enrollees receive APTC.
Okay, so continuing on, I think there's a general question, can names be in alphabetical order on the broker portal?
Unfortunately, that was not something that I verified, but I know that there are other filter options or sorting options. The one main thing was to make sure you can see all of your clients. That may be something we can work on in the future, but go ahead and check it out. If you see that it isn't, please send some feedback to the broker support inbox.
Okay. This is from Erica. So the last two clients, this is in her voice, obviously, the last two clients who have added Erica as a broker are not appearing in her client list. One of them was as long ago as a week. Is this a known issue, or is there a way to get this fixed?
Erica, that sounds like that might be a unique situation to you. So if you want to go ahead and send an email with the specific client information to the broker support inbox, which has been loaded in the chat, go ahead and send that so we can look into it specifically.
Okay, moving right along. Next question, if the person is age 65 and their income qualifies for Husky D, shouldn't they be able to enroll in Husky and be dual eligible for Medicaid and Medicare?
No.
No.
So the answer to that question is no. We don't know of any dual eligibles who are enrolled in both Medicare and Husky D.
Yeah, another eligibility question. Can we enroll Medicare clients in Husky C if they qualify?
I think this is something you would probably bring to the Department of Social Services, because we don't have any data on Husky C and HICS.
Okay. Moving right along, Another question, is pregnancy only a special enrollment event for Access Health Connecticut, or is this a new rule statewide that applies for employers as well?
One more time, Keisha.
So the question is, they're asking if pregnancy is going to be a special enrollment event only for Access Health coverage, or is this a new statewide rule that applies to employers as well?
I don't know
Yeah,
if
check on that.
employer coverage has been affected by this. That would be group coverage. We're only talking about individual plans sold through Access Health.
Another question, I have a client who is 65 and Medicare eligible, but they are on with QHP with their spouse. Will this still be the same?
So the verification services will be able to pick up if a client is enrolled in Medicare. I don't know that they would be able to pick up if they were eligible but not enrolled. I just wanted to make that distinction. And so you're saying if you have a client who is 65 and eligible for Medicare but are currently on a QHP with their spouse, would they be able to remain on it? I wouldn't be able to answer that here. You can send that to the broker support box.
Okay, is another question, is the pregnancy SEP still only for lawfully present women and not for undocumented women?
Yes.
Moving along, this is from George. Why don't you require the insurance providers to have commissions on if enrolled during special enrollment period?
Hi, this is Deb. That's not an issue that we can even discuss at this point. That's the carriers.
Okay, we move on to another question on client list. Could we have the option to see our clients listed alphabetically by last name and enrollment date?
Again, this is Deb. We can take a look at that. That might be something that we can do in the future. And I'm not sure of all the filters, so it's the alphabetical order of last name may be possible in your filters. I'm not sure about the date. So we can look into that, and it could be something in the future that we could ask for one of the releases.
Next question, since pregnancy is a qualifying life event, can the client apply for Husky A, then get the letter certified by the PCP, or does the client need to have a certified letter 30 days prior to applying for Husky A insurance?
Okay. So special enrollment periods, when we talk about special enrollment periods and qualifying life events, we're only referring to qualified health plan coverage. There is no special enrollment period for Husky. There are no qualifying life events for Husky. So they're not related in any way. No one who's eligible for Husky A for pregnant women is affected by the pregnancy certification or the new law that was implemented in 2019. There's no change to Husky A for pregnant women.
Okay, thank you. I see one more question on the list. Will there be a hotline for brokers to call next year?
This is Deb again. That's something we can visit. I'm not sure if that's something that's possible or not, but we will take your consideration and look at that.
Okay, I'm looking through. I don't see any other new questions. For people on the line, we still have time if you want to enter any questions into the chat box. If you haven't already noticed, our team is sending you some contact information through the chat box, email addresses. This will all be emailed to you as well afterwards, along with the presentation and any Q&As that we can summarize for the group to help keep everyone on the same page.
We have one last question.
Under the buzzer.
Can we get a list of clients pending cancellation for VCL? Typically, you can view your client's current VCL status through your broker portal and accessing their account that way. It's really between the broker working with their client specifically, tracking when VCLs do hit. I know we have a lot of veterans on the line, and you know typically it's 30 to 60 days out. You want to make sure you get the VCL sent in. One last question again. Why do escalations take an inordinate amount of time?
This is Deb. And depending on if we're talking escalation from a broker's perspective or from a consumer, it's peak for VCLs and other subject matters and urgent medical. So unfortunately, we're working them as quickly as we can from both perspectives, from a customer service and from broker support. And we're trying to work the priority ones as quickly as we can. That's the best I can say for right now for backlog and for VCL issues.
I will add this is Shelly. If you have already sent in an issue and you'd like to follow up, please refrain from sending multiple emails. Simply just send one follow-up with the FID, client name, some sort of identifier so we can check on that escalation for you. In the event that the escalation becomes urgent, please indicate that in the subject line. Urgent is described as if the client has urgent medical needs, or
Prescription.
has prescription needs, or in the hospital. Again, as Deb said, we are working as quickly as we can through it. This is our peak time of the season, and we're working as quickly as we can. We're going to go ahead and end the webinar here. We thank you for attending, both brokers and CACs. Those support inboxes are listed in the chat. For brokers, AHCT brokers support at ct.gov. For CACs, you can contact the ird.outreach@ct.gov inbox and send your inquiries or follow-up questions there. Again, thank you for joining us for this webinar. It'll be sent out to you in an email, so expect that shortly. In the meantime, you know how to reach us. Thank you, everyone.